It was the year 1874. The President of the United States was Ulysses S. Grant. New York City annexed the Bronx. The Jesse James gang robbed a train in Missouri. And in Newburgh, New York, a small group of women with little money and a whole lot of faith opened the home for aged and infirm. Their mission was simple: provide outstanding health care to their friends and the community. The ramifications were huge. It started out as just 3 beds in a small cottage, and eventually became a hospital with 2 campuses, 1,000 caregivers, and over 325 physicians. In their first year, the Home for Aged and Infirm treated less than a dozen patients, a number that would eventually leap to over 250,000 per year. Along with that climb in numbers came many changes over the years, including the name, as it later became known as St. Luke's Cornwall Hospital. But from day one, the essence of their philosophy never changed: with you for life. As the needs of the community grew through the years, so did the quality of care. In their new locations, they added maternity, pediatric, and emergency wards. By 1923, there was a pathology laboratory, an X-ray department, and the pride of knowing that they were fortunate in being so well equipped. The 1930s bore witness to several events that would help shape the future of St. Luke's Hospital and its community. One of them was the day Dr. Ernest Stillman established Cornwall Hospital, following the death of a young patient who was denied emergency care at a nearby facility. He built it on the promise that patients will always come first, and that no longer will anyone in this community ever be discriminated against. And 7 decades later, when Cornwall Hospital merged with St. Luke's, the values that Dr. Stillman began were still at its core. No truer words, "with you for life," than when we think of the over 188 employees who have serviced the St. Luke's Hospital community for over 20 years. It's that kind of dedication that has led to so many outstanding achievements and awards, including being the only New York hospital to win the same award 5 years in a row for their performance of preventable complications during hospital stays. Or being recognized for the 2nd straight year as an industry leader in using information technology to improve patient care. It's a list that goes on as the hospital evolves by adding new services to meet the needs of their community. Part of that evolution was recognizing that small community hospitals such as St. Luke's Cornwall can no longer stand alone. So began the journey to find a partner who would help them make a larger footprint in the community, a partner such as the Montefiore Health System. Their expertise in developing advanced models of care management to help patients in cost-effective ways will go a long way towards improving health care in the Hudson Valley.
We believe that we can strengthen the hospital, but not just the hospital, strengthen the community.
They know how to manage the health of a population. They do it better than anyone else, and they do it efficiently, they do it with high quality, and they lower the cost of care.
The board and the leadership of the organization was compatible with our values, and I am certain that we're going to be able to work closely and effectively with the leadership of St. Luke's.
St. Luke's Cornwall Hospital. They've come a long way. But then again, that's what happens when your philosophy is with you for life.